Tinea cruris, commonly known as jock itch, is a fungal infection that affects the groin area. It is characterized by red, itchy rashes that can be quite uncomfortable. Tinea cruris also could affect inner thighs and buttocks. It is caused by various types of fungi, including Trichophyton rubrum and Epidermophyton floccosum. The warm and moist environment in the groin area provides an ideal breeding ground for these fungi. Jock itch is more common in men, but it can also affect women. It spreads through direct contact with an infected person, contaminated objects, or by using shared towels or clothing. In this video, we will explore Tinea cruris overview, causes, sign and symptoms, diagnosis, treatment, home remedies, and infrequently asked questions. By the way, welcome to our channel. Don't forget to thumb up and subscribe. Causes of Tinea cruris. Tinea cruris is primarily caused by fungal infections, but certain factors can contribute to its development. These include fungal overgrowth. Fungi thrive in warm and moist environments, such as sweaty groin areas, making them more susceptible to infection. Close contact. Direct contact with an infected person or using contaminated objects can transfer the fungus to the groin area. Poor hygiene. Insufficient hygiene practices, such as not regularly washing the groin area, can increase the risk of Tinea cruris. Tight clothing. Wearing tight-fitting clothes that trap moisture and prevent proper ventilation can promote fungal growth. Weakened immune system. Individuals with weakened immune systems are more susceptible to fungal infections, including Tinea cruris. In Yuga medicine, the causes of Tinea cruris are attributed to an imbalance in the body's nature and blood, allowing external pathogenic factors like dampness, heat to invade the skin's nature. These pathogenic factors disrupt the body's natural harmony and contribute to the development of tinea. Treatment aims to address these imbalances and clear the pathogenic factors through herbal remedies, dietary adjustments, and external applications. Signs and symptoms of Tinea cruris. The symptoms of Tinea cruris can vary from person to person. Common signs and symptoms include redness and itching. The affected area may appear red, and intense itching is a characteristic symptom of jock itch. Rash. A raised, red rash with defined edges often develops in the groin area. The rash may spread to the inner thighs and buttocks. Scaling and flaking. The skin in the affected area may become scaly and start to flake. Burning sensation. Some individuals may experience a burning sensation or discomfort in the groin region. Cracked skin. In severe cases, the skin may crack, leading to pain and potential secondary infections. Diagnosis of Tinea cruris. If you suspect that you have Tinea cruris, it is advisable to consult a healthcare professional for an accurate diagnosis. The doctor will typically examine the affected area and may collect a skin sample for further analysis under a microscope, or through a fungal culture. These tests help confirm the presence of fungal infection and determine the specific type of fungus involved. Treatment options of Tinea cruris. Treatment for Tinea cruris usually involves a combination of antifungal medications and proper hygiene practices. The following treatment options may be recommended. Topical antifungal creams. Over-the-counter or prescription-strength antifungal creams containing ingredients such as clotrimazole, miconazole, or terbinafine can effectively treat Tinea cruris. These creams should be applied to the affected area as directed by a healthcare professional. Oral medications. In severe or persistent cases, oral antifungal medications may be prescribed to combat the infection from within. These medications are usually taken for a specified period as prescribed by the doctor. Hygiene practices. Maintaining good personal hygiene is crucial for treating and preventing Tinea cruris. It includes regularly washing the affected area, thoroughly drying it after bathing, and avoiding tight-fitting clothes. Prevention tips for Tinea cruris. Preventing Tinea cruris involves adopting certain lifestyle habits and taking precautions to minimize the risk of infection. Here are some preventive measures. Keep the groin area clean and dry by regularly washing and thoroughly drying it after bathing or exercising. Avoid sharing personal items like towels, clothing, or sports equipment, as they can spread the infection. Wear loose-fitting clothes made of breathable fabrics to allow air circulation and prevent excessive sweating. Use antifungal powders or sprays in areas prone to sweating to keep the skin dry and inhibit fungal growth. Maintain overall good hygiene practices, including regular bathing, washing hands, and keeping other parts of the body clean and dry. Natural home remedies for Tinea cruris. While medical treatment is recommended for Tinea cruris, there are some home remedies that may provide relief and support the healing process. These include tea tree oil. Known for its antifungal properties, tea tree oil can help alleviate symptoms of Tinea cruris. Dilute a few drops of tea tree oil in a carrier oil, such as coconut oil, and apply it to the affected area. Apple cider vinegar. The acidic nature of apple cider vinegar helps create an unfavorable environment for fungi. Mix equal parts of apple cider vinegar and water, and apply the solution to the affected area using a cotton ball. Rinse thoroughly after a few minutes. Garlic. Garlic possesses antifungal properties that can combat the infection. Crush a few garlic cloves and apply the paste directly to the affected area. Leave it on for 20 minutes before rinsing off. Aloe vera. The soothing and healing properties of aloe vera can help reduce inflammation and itching. Apply fresh aloe vera gel to the affected area and leave it on for 20 minutes before rinsing. Coconut oil. Coconut oil contains a compound called lauric acid, which exhibits antifungal properties. Apply virgin coconut oil to the affected area multiple times a day to soothe the skin and combat the infection. Salt bath. Taking a warm bath with salt can help alleviate itching and reduce fungal growth. Add a cup of salt to your bath water and soak in it for 15 to 20 minutes. Pat the area dry afterward. Remember, while these natural remedies may provide temporary relief, it is essential to consult a healthcare professional for proper diagnosis and treatment of Tinea cruris. Frequently asked questions about Tinea cruris. Is Tinea cruris contagious? Yes. Tinea cruris is contagious and can spread through direct contact with an infected person or contaminated objects. Can women get Tinea cruris? Yes. Although Tinea cruris is more common in men, women can also develop this fungal infection. Does Tinea cruris affect children? Yes. Children can also develop Tinea cruris, especially if they participate in sports or have poor hygiene practices. Can Tinea cruris be cured completely? Yes. Tinea cruris can be cured with appropriate treatment and preventive measures. It is important to follow the prescribed treatment plan and maintain good hygiene practices. Thanks for watching. Take care and stay safe.